Hi everyone, I'm Tammy and I'm the Staff Development Manager for Home Health and Hospice. Today we're going to be going over proper bag technique, but before we even get into the proper steps of how you perform bag technique in a patient's home, I wanted to quickly remind you a couple of things. Your bag is a vehicle of transmission for germs and bacteria from patient to patient and even to yourself. And so it's really important for you to remember that there are certain things that you must follow when you're out seeing patients in the field. Your bag has various compartments, so utilize these compartments to separate items that are dirty versus clean. Dirty items are items that you're reusing from patient to patient. So things like your stethoscope, your thermometer, your pulse oximeter, and your blood pressure cuff should be separated from items that are clean. So if you look here, I have a front compartment, and all of the items that I reuse on patients for their vital signs are in this specific compartment. They don't touch the rest of the compartments that house my clean items, such as my wipes, my alcohol pads, my gloves, and my PPE. So in addition to all of the items that you may need to perform your visit, you must also make sure that you have all of these items with you at all times. That includes your PPE set. Always make sure that you have your goggles or your face shield. You should also always carry extra barrier drapes with you. Please carry your hand sanitizer and soap. And I want to quickly mention that the hand sanitizer and soap should only be the brands that we actually provide for you. You're not allowed to purchase anything else that isn't given to you by Torrance Memorial. One last item you should always carry with you is your CPR mask. If you don't have a CPR mask or was never given one, please make sure you let your manager know so that they can get you the appropriate equipment. Now let's actually do a patient visit. Remember, when you're going from your car to the patient's home, your bag should always be closed and you should never be carrying your iPad with you. Once you're in the patient's home, make sure you designate an area where you can place your medical bag. If there's no area for you to put your bag at, you can always hang it on the back of a door or use a heavy chair. Now this is where I'm going to be placing my bag. Note that I'm already carrying my hand sanitizer because I want to make sure that my hands are clean before getting into my bag to grab some drapes. So it's up to you whether or not you want to place your drapes in an area that's easily accessible for you. I like to place my drapes in a clean area, making sure that it doesn't touch any of my dirty equipment. So I'm gonna go ahead and grab my first drape. And I'm gonna lay my drape down, making sure that my medical bag is draped and that the straps are tucked in. I can then grab my second drape, and this is where I'm going to be placing all of my vital signs equipment. Anytime you're going into your bag to grab equipment, you want to make sure that you close the zippers all the way. So I'm going to grab all of the equipment that I need to perform my vital signs on my patient. I also want to make sure that I grab gloves, so it really depends on the procedure that you're going to be doing for your patient. I usually, by rule of thumb, put out about 3 to 4 sets of gloves just to make sure that I have enough throughout my visit. So I'm going to leave out the clean gloves here. The last thing I'm going to grab is going to be my iPad. Now note that your iPad goes with you everywhere, and it also goes from patient to patient. So your iPad is actually considered dirty, and it does not need to sit on the clean barrier drape. It can sit outside on a patient's table, doesn't need to sit on a drape at all because you're gonna keep coming back to it to document. Ready to do the actual visit on our patient. So before even touching the patient, you wanna make sure that you hand hygiene. And you hand hygiene anytime you're gonna be putting on gloves, taking off your gloves, going into your medical bag, anytime you're done with your visit and anytime you enter the patient's home. I'm gonna go ahead and put on some gloves before I take my patient's vitals. And once I take my patient's vitals, the equipment that's on this drape is no longer clean. So if I'm going to take my patient's temperature, I've taken their temperature and it can now sit outside, okay? So any equipment that you're using on patients is now dirty. It does not go back onto your clean drape, okay? So I'm done performing all of my vital signs on my patient. I'm going to go ahead and leave the equipment out on their table, and when we're ready to clean, we'll come back to it, okay? So now I'm going to remove my gloves because it's time for me to document their vitals into the iPad. Before I touch my iPad, I'm gonna go ahead and hand hygiene because I've just removed my gloves. I'll come over to my iPad and I'll document whatever their vitals are and whatever documentation I need to pull up. Once I'm done with that and I'm ready to come back and clean my vital signs equipment, before putting on gloves, I will go ahead and perform hand hygiene again. And this is when we're gonna start cleaning our equipment and making sure that we observe the wet times. So I highly recommend that you wear gloves when you're removing the wipes. We have the Cavi wipes, which are our 1-minute wipes. And then the PDI Easy Screens are our alcohol wipes that we use on equipment that does have a battery. So once we get our gloves on, I'm gonna go ahead and remove the wipes. So every clinician should have Cavi wipes, which are the black tops, and every clinician should have the white wipes. And these are our PDI Easy Screens that we use on all of our equipment that has a battery. So I'm actually gonna take out 2 sets. So I'm gonna take out 2 wipes from each. And after I've done that, I wanna remember to close the zippers on my bag again. And now we're ready to clean. When we are ready to clean our equipment, we wanna make sure that we don't contaminate our hands and that we do not touch any equipment that is dirty. So I'm gonna go ahead and start with the items that have a battery. So I'm gonna be using my PDI alcohol wipes first. If I was to touch the equipment sitting out on the patient's table or counter with my bare hands, I would then be contaminating all of the surfaces that I touch, right? So instead, you wanna use the 2-wipe method. So with that, whichever hand is your most dominant hand that you're gonna be using to wipe, it's really up to you. I'm right-handed, so I pick up the equipment with my left and I clean with my right. So I wanna make sure that I really clean the equipment well. It should be clean for at least 30 seconds and that you're covering all the surfaces. So once this 30 seconds has passed, you'll just go ahead and drop the equipment down back onto your clean barrier drape. Grab your next equipment and continue cleaning for 30 seconds, making sure that you cover all surfaces and everything is cleaned. I'll just go ahead and drop this down again on the clean surface. If I don't have anything else that needs to be cleaned, I can go ahead and discard these. I will then pick up the Cavi wipes, which are a lot more saturated, and these wipes is what you're gonna be using on your stethoscope and your blood pressure cuff. So unfortunately, I don't have a stethoscope to show you how to clean, but we are going to clean our blood pressure cuff. So it's really important for you to make sure that you clean your blood pressure cuff and that you're covering all surfaces and you're using the wipes to its full capacity and observing the 1-minute web time. So if that means you having to clean your blood pressure cuff twice to make sure that it stays wet for the entire minute, you wanna make sure you do that. And we're gonna go ahead and clean for a minute. So once you're all done cleaning, you're gonna allow the blood pressure cuff to dry completely and all of the equipment to lay out on the clean barrier drape and dry. So after your equipment has dried, you wanna make sure you hand hygiene. And this is the time where you can either allow your equipment to dry while you go and perform any wound care or IV therapy care, whatever it is, and then you can come back and put your equipment away. Or you can allow it to dry, do your assessment, and then come back to your equipment. We just want to make sure that all of your equipment lays out on the drape completely dry before it goes back into your bag. So we're actually gonna go ahead and put all of our equipment back. This is the end of the visit. So as of right now, all of my equipment is dry. I just did my hand hygiene. I'm gonna grab all of the equipment that I have and I can go ahead and place it back into my medical bag. Once I am done with the visit, I'm ready to get my patient's signature. So now you're ready to get your patient to sign for the visit. I'm gonna go ahead and hand hygiene because I'm gonna have to go back into my bag to get an alcohol wipe. And you wanna make sure that you wear gloves and that you hand hygiene anytime you're gonna go back into your bag. So I've hand hygiene, we're gonna put on some gloves. So now we're gonna grab an alcohol wipe. And this is what you're gonna be using to clean your iPad after your patient is done signing for their visit. So I'm gonna go ahead and log into my iPad, and I'm gonna have my patient sign for their visit. So after they're done signing, I'm gonna go ahead and hold my iPad open, and with the alcohol wipe, I'm gonna make sure that I clean not only the screen where the patient has signed, but I'm also cleaning the keyboard. And I'm gonna flip it over and make sure that I clean really good the back side where the iPad was sitting on the patient's surface, okay? So after you clean this and everything is nice and clean, you're gonna go ahead and allow this to air dry. So you're gonna leave your iPad open this way for 30 seconds. And before I clean up anything, I wanna make sure that I clean my hand sanitizer bottle because it's been sitting out on the patient's table. And I'll leave this to dry. I can now remove my gloves and clean up any trash that I have left. Once this is dry, I can go ahead and close my iPad and put it back into my bag. So you are all done with your visit and it's time for you to leave. You can go ahead and grab your medical bag, and at this time, this is when you're gonna discard of any trash or the drapes, extra drapes that you have. So I'm gonna go ahead and just grab all of the trash and have the patient's family discard it for you before you leave their home. So I'm just gonna put this to the side. I'm ready to leave, and before I do that, I wanna make sure that I hand hygiene and that I put my hand sanitizer back into my medical bag and close my zippers all the way before I leave my patient's home.